we will discuss the female reproductive system. Starting with the ovaries. The ovaries are the female gonads and they are lying in the ovarian fossa located at the lateral pelvic wall. This is the lateral pelvic wall. This is the ovarian fossa where the ovary is lodged. Now, the ovarian fossa is bounded anteriorly by the obliterated umbilical artery and posteriorly, as you can see, by the ureter and the internal iliac arteries. Now, the ovary is variable in position. In nulliparous woman, that is the woman who has not given birth, it is long. The long axis is nearly vertical, as you can see, so that the ovary has an upper pole over here and a lower pole over here. However, in multiparous women, that is the women who have given birth, this long axis, it rather than becoming vertical, it becomes horizontal. Horizontal in such a way that the upper pole faces laterally and the lower pole faces medially. Coming to the external features of the ovary, this is the ovary over here. In young girls, before the onset of ovulation, the ovaries have a smooth surface and grayish pinkish in color, whereas after puberty, the surface becomes uneven. Can you see the irregular surface of the ovary? And the color changes from pink to gray. Now, here you can see each ovary has two poles or extremity. The upper or the tubal pole related with the uterine tube and lower or the uterine pole related to the uterus. It has two borders, one anterior border. Here you can see this is the anterior border, this is a schematic diagram, or the mesovarian border, and the posterior border of the ovary, which is free. It also has two surfaces, the medial surface over here and the lateral surface. Relations. Now, coming to the peritoneal relations of the ovary as you can see is almost entirely covered with the peritoneum except along the mesovarian border or the anterior border where the two layers of the covering are reflected onto the posterior layer of the broad ligament of the uterus. This is the broad ligament. Here you can see these are two layers of the mesovarium, right? Now, so this ovary is connected to the posterior layer of the broad ligament by the short fold of peritoneum called the mesovarium over here. You can see the squamous epithelium of the mesovarium is continuous with the cubical epithelium of the ovary. And this mesovarium is transmitting the vessels and nerves to and fro from the ovary. Now, the lateral part of the broad ligament of the uterus that is extending from the infundibulum of the uterine tube to the upper pole of the ovary to the external iliac vessels forms a distinct fold known as the suspensory ligament of the ovary or the infundibulopelvic ligament containing the ovarian nerves and vessels. Now, coming to the visceral relations, the upper or the tubal pole, it is broader than the lower pole related to the uterine tube and the external iliac vein. The right ovary may be related to the appendix if the latter is pelvic in position. The ovarian fimbria, as you can see over here, and the suspensory ligament of the ovary are attached to the upper pole of the ovary. The lower or the uterine pole, narrower than the upper pole related to the pelvic floor. It is connected by the ligament of ovary to the lateral angle of the uterus, posterior inferior to the attachment of the uterine tube. This ligament lies between the two layers of the broad ligament of the uterus and contains the smooth muscle fibers. Now coming to the anterior or the mesovarian border, It is straight and related to the uterine tube and the obliterated umbilical artery attached to the back of the broad ligament of the uterus by the mesovarium and forms the hilus of the ovary. Now, posterior or the free border, convex and related to the uterine tube and the ureter. Here, ureter is over here, posteriorly. Lateral surface related to the uterine fossa, lined by the parietal peritoneum. This peritoneum separates the ovary from the obturator vessels and the nerves. The medial surface, largely covered by the uterine tube, the peritoneal recess between the mesosalpinx and this surface is known as the ovarian bursa. The lower pole and the lateral surfaces are not related to the uterine tube, whereas the remaining two borders, upper pole and the medial surface, are related to the tube. Arterial supply. The ovarian artery arises from the abdominal aorta just below the renal artery, descending over the posterior abdominal wall and entering the suspensory ligament of the ovary, like this. It is sending branches to the ovary, as you can see over here, through the mesovarium, right, and continues medially through the broad ligament to the uterus for anastomosis with the uterine artery. You can see the uterine artery over here. In addition to ovary, the ovarian artery also supplies the uterine tube, the side of the uterus and the ureter. The uterine artery gives some branches which reach the ovary through the mesovarium. The venous drainage. Veins emerge at the hilus and form a pampiniform plexus around the artery. The plexus condenses into a single ovarian vein near the pelvic inlet. The vein ascends on the posterior abdominal wall and drains into the inferior vena cava on the right side and into the left renal vein on the left side. You can see the ovarian vessels over here, the ovarian vein. The lymphatic drainage. Lymphatics from the ovary communicate with the lymphatics from the uterine tube and the fundus of the uterus. They ascend along the ovarian vessels and drain into the lateral aortic and the pre-aortic nodes. The nerve supply. The ovarian plexus, you can see, derived from the renal, aortic and the hypogastric plexuses accompany the ovarian artery, contains both sympathetic and the parasympathetic nerves. The sympathetic nerves T10 to T11 are afferent for pain as well as efferent for vasomotor, whereas the parasympathetic nerves are vasodilators. Function of the ovary, production of oocyte. During the reproductive cycle, ovary produces alternatively one secondary oocyte per month per ovarian cycle of around 28 days, and liberation of this oocyte is called ovulation, which is occurring about the 14th day of a 28-day menstrual cycle. Now, variation in the length of the menstrual cycle are due to variation in the pre-ovulatory phase, whereas the post-ovulatory phase remains constant. The oocyte is viable, that is capable for fertilization for about 12 to 24 hours. Production of hormones. Estrogen secreted by the follicular and the paraluteal cells, whereas progesterone is secreted by the luteal cells. Right. So determination of ovulation can be done by repeated ultrasonography in case of sterility. Prolapse of ovaries, they are frequently displaced to the pouch of Douglas where they can be palpated by a pervaginal examination. Carcinoma of ovary is quite common. accounts for about 15% of all cancers and 25% of the gynecological cancers. Ovarian cyst, they are developmental arrest of ovarian follicles, may result in the formation of one or more ovarian cysts. Multiple small theca luteal cysts involve both the ovaries in case of Steen-Leventhal syndrome. Now, this syndrome is characterized by mild hirsutism, as you can see over here, a deep voice, secondary amenorrhea, and this cystic enlargement of both the ovaries. The ovaries are the commonest site in the abdomen for endometriosis, and the endometrial cysts in the ovary are called the chocolate cyst. Now, just have a look at how the ovulation occurs. So you can see this is the upper pole or the tubal pole of the ovary. This is the lower pole or the uterine pole connected by the uterine ligament of ovary, right? You can see the fimbriae are beating, and this process of expulsion of ovum is the ovulation. You can see this is one fimbria that is helping in facilitating the movement of the ovary within the fallopian tube, where the sperm are waiting to fertilize the ovum. Here is the fertilized ovum which has implanted into the uterine cavity. So hopefully the parts of the ovary are clear to all of you. Thank you.